I'm telling you, so busy, but I did get the class all done, got the eyes all done and out. Oh, I'm caught up with all your 14-week protocols and iris analysis except one. So we're doing pretty good that way. How have you all been? You've been hitting it hard? I've been having a lot of meetings here, a lot of things going on. I know poor Marcy just got a 2.5-year-old leukemic case. You know, a sad thing, you know, when you're putting a 2.5-year-old baby on chemotherapy, it just makes me want to throw up. The idiocy, the extreme idiocy of that level of thinking is beyond belief. I certainly hope that you beautiful individuals will help me to teach this world the truth, so we don't see the slaughter of these poor children that soul just getting here. And humans need to understand what's causing their problem. How simple is it, isn't it, guys? How simple? How simple is it? But how the intellectual mind makes it appear to be so complicated no one can figure it out. And yet simplicity always rules. Complications, complexities, they end up nowhere. You know, they end up controlling you and limiting your experience. Keeping things simple in your world is vital, especially for those of you that recognize spirituality and you realize that, you know what, I don't want to play in creation anymore. I want to wake up. I want to quit watching the movie. Yeah, I've been watching this movie for a long time. Some of you just got here and playing with the movies, but a lot of you guys are ready to go to a much higher level of experiencing. And you must realize that what you create right now is your future. Thoughts is your future. Remember, your thoughts are not yours. You are consciousness. Your mind is only a vehicle that you take on, created out of the essence of creation, like the physical body. You're the living consciousness, the living awareness within the body. But that living awareness is non-physical. So therefore, when the physical body can't house you anymore, you pull your attention away from it. You leave your physical body because it can no longer house you. And when those happen, you start to realize how grand things are, because there's all levels to go to and experience. Like going to big cities and department stores, there's all levels of things. Everywhere to have fun. This is one of the most difficult levels, of course, very chemical levels. We've talked about that a great deal. But don't take things too seriously here. Even if you're in pain, pull back, pull back, pull back. Realize the simplicity of what's causing pain, what side of chemistry it's on, what system in the body it's on. You now are learning how the body works. Matter of fact, I never know so many people that understood about the parathyroid gland and what happens in depression, bruising easy, cramping, all of these things, varicose veins, spider veins, hernias, hemorrhoids, aneurysms. These are all parathyroid and / possible pituitary problems. And you can fix those. You can fix everything. Because you want your experience to be fun, not controlling. You don't want to control other people in your life. You want to be free, and you don't want anybody controlling you in your life. You want to be free to enjoy the beauty of freedom and joy and experiencing new things, not getting trapped in old thoughts and things like this. The mind works on grooves like records, you know. Phonograph records, you've got the grooves, and it can't get out of them. Only you can pull yourself out of them. The mind gets locked in these grooves. So it's only your awareness that go, oh, you know what, I'm tired of that. That sort of thing. So let's look at some of your questions here. I was trying to think, I just got talking with Marcy, and we were talking about the cancer cells, and I know she has this one gentleman, and he had his prostate removed, but his PSAs are going up, And I see that all the time. And you think that those antigens are just related to the prostate. They're not. The pelvic area and all of this. So remember that you're talking about the lymphatic system. It is not exclusively exclusive to one tissue or another. It's inclusive to every tissue. The lymph system is a system that infiltrates all interstitial spaces from head to toe, and that's around every single cell you have. The only cells that really touch each other is your blood cells, and that's when you don't want them to. You don't want your blood cells to butt up with each other or clump or follow each other like choo-choo trains. You ever watch blood work and follow blood cells? You don't want that. You want individual cells. So acids, even though they're corrosive and catabolic almost, they have the effect of agglomulation. Things coming together, sticking. And it's the alkaline chemistry that makes more fluidity and breaks up this agglomulation. It's all in the chemistry of it all. So let's look at these things. Oh, I had this because I want to show you this every once in a while, but just to show you, and I had Jen B make this, but just to show you over and over again. You know, everybody's so wrapped up in nutrition, and I think it's because their machine is down. Think about this. This is a chemical processing plant. This is a food processor, basically. So you have digestion, number one. That is breaking apart complex chemistry into simplistic chemistry again, because absorption is only for the simplistic in mind. Then you have absorption. Well, if your interstitial spaces in your small bowel wall is all backed up lymphatically, which, let me see, 99% of most people are, at some degree or another, so that's going to yield you malabsorption. The pancreas is the main digestive organ, so pancreatically, a lot of people have a lot of weaknesses in the pancreas in digestion, and then there's the portion of the small bowel that deals with that, and the pancreatic duct. So there's a lot there that has to be healthy for proper digestion and absorption. So if those two things are accomplished, what would be the third? Utilization. How does your body utilize chemistry? How does your body utilize blood sugar? Adrenal glands. How does your body utilize iron? Adrenal glands. How does your body utilize zinc? Adrenal glands. So let's say you were diagnosed with low iron. People look to iron supplements or go to liver formulas and stuff. What about the adrenals where it's metabolized? And how many people have adrenal weaknesses? 99%. I mean, this just goes on and on. So digestively, not everybody's down pancreatically, but I would say a good 40% of everybody is. Then you've got malabsorption, which 99% of people have malabsorption issues. That's factual. Then you got utilization. How many people do you think have their adrenals down on this planet in the 21st century? Just about literally everybody. Literally. So that's a big problem, the utilization of chemistry. Now we come to the final stage. After the body's digesting and absorbing and utilizing all this, and the processes of all the cribs and everything is going on, now you got all the byproducts. How does your car get rid of the byproducts from combustion? How does your body get rid of the byproducts from combustion? A universal question that needs to be answered. Medical doctors have just never figured that one out. Drops it back into the venous system. No. Esoterically disappears. Doubt it. Now that we know that there is some piggybacking, because when you get into A and P, you look at the lymph vessels. They're not piggybacking, but when this new discovery in the brain of the lymphatic system of the brain, piggybacking brings up a lot of interesting thought about either diffusion or osmotic magnetic pulls of acids out of the wall. I mean, you just don't know. I mean, we have to admit, we only know that much about the human body. So we have to look at these systems like this and realize that our suffering is simple. Man decided to eat acid ash forming foods, foods that are not in harmony with his body. So therefore he has inflammatory responses constantly from the very food he's eating. So the number one problem man faces is inflammation, which is another word for inflammation. Remember, inflammation isn't a problem. Inflammation is your body's response mechanism. To what? What would your body respond to? Microorganisms? Oh Lord, that one has caused a lot of deaths and stuff. How about to acids and metabolitic waste? How about to the very things that have to be eliminated out and not ingested? You know, when you look at this, again, where's protein on this chart? See that? So if you're a heavy meat eater, your protein goes up to the number 1 slot. And if you don't eat vegetables or fruits, then your carbohydrates go way down to the bottom slot. That's almost the flip of tiger's milk. Tiger's milk has lipids as number 1, protein is number 2, and carbohydrates number 3. However, when you realize carbohydrates is your carbon chains, and carbon is your energy mechanisms like gasoline and fuel, and that those species that don't get high carbon foods have no energy. Look at a cat. They have big paws, big nails, big teeth, but they sleep 20 to 22 hours a day. How many hours in a day? So you see what I'm saying? When you understand that when you eat a high protein diet, you're eliminating the energetic foods of life, the foods you're supposed to be eating. No species except the carnivore, and they're made for that, but the price they pay for that. Other species, that is not high on the list, including grizzly bears, remember? So get off this high protein kick. Medical doctors and naturopaths that are on this kick are basically sentencing their patients and clients to Hellville and accelerating them to it. Especially you come to a naturopath diagnosed from a medical doctor with cancer, you're scared out of the wits, you don't know what the word cancer means, and a naturopath puts you on high protein. Whew. Man, idiocy. It's just extreme idiocy. And it's just amazing why naturopaths call themselves naturopaths, but it is what it is. You guys are the premier understanders of health, and you're demonstrating it to the world, which is pretty cool. All right, Dr. Morse, a few years ago I got a yeast infection. It seemed to pass, but still often reoccurs and hasn't been the same down there. Around that time I started getting acne. All right, so when you start seeing the yeast infections like this and then the acne, what system is getting worse in your body, honey? The lymphatic system. Yeah. Because remember, every day that you don't filter is every day that wears all those wastes from head to toe going. Out the skin? Maybe. And if you're having skin problems, maybe not there either. So then when you wake up to a cyst or a tumor, you're going, well, where did that come from? Not realizing that you have been developing this since you got out of your mother. Because people don't eat self-cleansing diets. You know, self-cleansing diets are your fruits, berries, melons, and salads. They're self-cleansing to your kidneys, to your lymph system, to all of that. They're hydrating. Everything else down on the crap list. But I developed that Heal All tea for douching, and I would highly recommend you ladies. When Jennifer was a young girl, she used it, and she got something out of her. It was quite unusual. But this is a great tea for converting atypical cells, but a great tea for douching. The reason why I created it, we realized you can do everything with that thing. So just telling you that your kidneys are down, your adrenals are probably down with it, honey. So you really want to look at that and get your kidneys to filter. Only very mild, but you know, it can grow and grow and grow. The acne progressed, and me not knowing about natural health at the time went on antibiotics. But you wouldn't know, and this is the sad thing about it. You know, they're going after this on an antibiotic thing, and the same thing would be true with the yeast infection. Why would you give someone an antibiotic with the stress of killing lymph node bacteria, which you do not want to do, for the sake of having a fungal problem? Bacteria, matter of fact, people that give antibiotics for medical doctors to women, they generally get yeast infections from antibiotic use. I mean, ugh. After 2 years of being on them, I realized being on them wasn't living in alignment. Absolutely. You know what? And you probably destroyed a lot of your bacteria in your lymph nodes. And it's like, where do these, the day of the archaic medical mind has to end. They're hurting so many people nowadays because the genetics and the lymphs are just 1,000 times worse than ever before. Alignment with me, and I am, and my beliefs for, and natural living and health. I came off of them around 6 months ago. Thank you, dear. And my skin is at an all-time low. That's okay. You got to start kicking up the detox. We've showed you picture after picture. Miss Philippines, the lady in Dubai, Shane's woman, a lady he worked on. Just how one of our YouTubers are sitting there healing people of all kinds of things. Incredible. Shane, you're doing incredible. I'm proud of all of you guys for helping others and healing others. You're just... There's nothing like it. When you see people suffering, and I love this name here too. Every square inch of my face is covered in acne and scars. Yeah, that's the thing. And why is it scarring? Acids. It goes back to acids. Remember, there's only two sides of chemistry. Acne, psoriasis, all of this is acid, heavy acidosis with no kidney filtration. So you got to open up the doors. Now that means that it could look worse because now you're expectorating what you're holding in. Remember, see how you see it progress, because every cell in your body produces acid waste constantly. Well, at least, regularly throughout the day. So the question, how does your body get rid of metabolitic waste? Acids, how does your body get rid of them? If you listen to the medical mind, probably not going to be a happy camper. Die early, go through the hell of antibiotics and everything else. But when you understand that it's your lifestyle, it's your diet, it's your mom, it's your chemistry you're interfacing with. The body isn't I can take any chemistry you can give it body. That is not true. Each vertebrae is restricted to a certain type of chemistry. That's why your food sources are a little different for each vertebrae. Designed for that particular vertebrae. Look at the herbivores. You've got a more robust being, more amino acids needed, more muscle structures, more stuff. So you've got foods that require multiple stomachs, grinding teeth, the greens. So you just realize that you have to put the Homo sapien in its proper vertebraic stance, and that is primatish. We're frugivores, and you can't deny that. We've showed you pictures of teeth, limbs. I've taken my section of that to two veterinarians, to one a female, one a male, and say, show me where I'm wrong. They couldn't do it. The female said, can I add beaks to omnivores? I said, yeah, I forgot that. So, that's the sort of thing that when you really tear this apart, you find the truth of it all. And you guys have found the truth of it all. Now, it's time on the pavement. It's time working it. And it isn't always a fun thing because I've said this before. It's like taking your beat up car into a body shop and letting them strip it down, sand it up, and polish it up and repaint it and fix it up. And that's just what you're doing. So your body doesn't look that good sometimes. You get thin because malabsorption is a fact, so now your body's going to clean all that out, and you can't get it cleaned out till you do the lymph system. Well, you got to be on the fruit to get the lymph system, so it does make you a little skinny because malabsorption doesn't make for muscles, but we've showed you a lot of people that put on muscles after fruit eating. And when you get your wild orangutans, they're pretty big people, and they're exclusively fruit eaters. But that'll come clean. All of this will come clean. But what it means for you, you're destroying skin tissue now. Remember, your skin's made of cells, so you're getting scar tissue. But that's your acidosis. You got to get your kidneys filtering. Get your kidneys filtering at all costs. Dry fast. Put yourself on a grape fast right now. Put yourself on you need a 20-day grape diet right now. Just put yourself on a 20-day grape diet. And do some dry fasting in there and get on some herbs for the kidneys, the adrenals, and go after this. I got an iridology scanning and show sulfur in her eyes. Yep, well, You know, that's even, well, that explains why you're having constant yeast infections right there. You know, I've said this, and I've been, you know, I have this thing about people in academics, you know, because they've hit me so hard in academics, and it's like, is that where you really learn truth? You learn truth with your awareness. I mean, awareness is where all the information is, guys. I mean, the awareness, your information is not in books. That's people who write information that they learn and get. And so you want to take a look at that. So I've watched this for a lot of years, the orange, the sulfurs, and the fungus involvement. And I can tell you unequivocally that sulfur is a fungal aphrodisiac, and that with those that have sulfur problems have major fungal problems. So you've got to clean the sulfur out, which isn't fun or easy. Remember Goodyear? And he used sulfur drugs to harden up his rubber so he can make a tire. I wonder what they put in there now. Sulfur compounds. Charles Goodyear. I mean, and of course, when you get it in your gut like that, it hardens your gut, and then you get constipation, heavy fungus, then you got your odors, and you got your gas, and your bloating, and it's just a nightmare from hell. What did they give me antibiotics for? Because my lymph system was a problem, and they thought bacteria caused it? Is that what it is? I don't know what it is. You know, you got to remember, antibiotics are great suppressants. They're not just antibiotics. They suppress your immune system. So is that really what the game is? The treatment game is the best way to put yourself into Hellville. Treatment. Like people want to treat themselves. They don't go fast enough with this sometimes because you've got miles of pathways that have to be hydrated and filtered out of the kidneys or skin. So they want to try go back on some of these isolates like vitamin C, intravenous vitamin C. I don't care how beautiful you think a mineral or a vitamin or any type of constituent might be, whether it's a flavonoid, a tannin, a coumarin, alkaloid. If it's acidic, I don't care what the name of it is. It can be phosphorus, nitrogen. If it's acidic and it's dominating the food source, then that's what your blood gets. That's what your bowel wall gets. And these are acids. Well, being that the blood is predominantly alkaline, does it make sense to put predominantly acids in the blood? What could be some of your problems besides death? Yeah, serious stuff, because then you invoke not the bicarbonate medical doctors, your calcium channels, and that's when you see all the petechia, the bruising easy, the varicose veins, the spider. How did you see connective tissue loss? What would do that? What's the integrity of the connective tissue, the matrix, calcium? It's just like any other bone matrix, calcium and phosphorus. Little brother, big sister. Big sister alkaline, little brother phosphorus, iron, acid. All right there. So that's why you have so much fungus, honey. Got to get the sulfur. I'd put myself on Parasite M, probably 2 dropper fulls, 4 times a day for a while. It's not going to get rid of all of it because you've got to get your lymph moving. Now that this is so much involved in it, you've got to get your lymph system to clean all the fungus out and get the sulfur out of there because it'll just perpetuate more fungus. Nothing fun about having sulfur in the body. I tell you, my eyes have had yellow around the pupil since I was a kid. I'm sure you were born with it, or your mom gave you a lot of antibiotics when you were growing up. You could have had a lot of lymphatic problems, them not understanding the kidneys or anything, and just load you down with antibiotics. Because that's when they give it to you, is when you have lymphatic problems or symptoms like cold and flus and things like this, mumps and measles. These are all lymphatic problems. They give you antibiotics for it, not realizing that this is a system that is down. And that interfacing with any type of microorganism could create an immune response of detoxification. You should allow the detoxification to take place, therefore you're done with that, and you can go on and have a good life. But what we do is keep suppressing what we're creating. And then when your body gets loaded, then your skin explodes and everything explodes, and then you wonder what's going on and why it takes so long to get remedy, and it took so long to create it. Some of you are just come right out of mama with it because mom's so bad. Oh, but at least man is learning this and can take action if so desired, or not. I say, matey. I also have a lot of digestive issues. Yeah, and that would actually help create that as well. It's sulfur in the gut like that, honey. I had anxiety and mild depression before the acne came back. All right, so think about this. She had mild depression and anxiety. Okay, so anxiety, where are we going? Adrenal glands, neurological. Depression, where are we going to? Calcium, right? We're going to calcium, so where are we going? Parathyroid gland. If you have depression, you want to fix your parathyroid gland and start utilizing calcium. Now, if you're short, tall, monthly cycles are irregular, maybe you wet the bed when you were a kid up till age 10, pituitary. You vitiligo, pituitary. Look at that pituitary because you might have to work on both of those tissues to get your calcium utilization back in line. That'll help the depression, but you have anxiety. That's neurological. They're bipolar, two different endocrine gland involvements. She says now it's debilitating. Yeah, it's because you must be going into a crash of the adrenals and that sort of thing. Or you could have a pituitary going down on you, and therefore it's bringing everybody else down with it. So you just have to look at that. Are you short? I don't know. I've that's the kind of impression I'm getting. I'm even considering antidepressants. No. Fix this the right way. Use moonshine yarrow, whatever you can, while you're getting on the parathyroid. I would do a parathyroid glandular. We have 50 milligrams. I do 2-3 times a day. If it was me, I would hitchhike that with a pituitary herbal or an endocrine gland herbal. At the same time, I'm on the kidneys, I'm on the adrenal glands, I'm tearing into my body. I'm going to get this opened up. I'm going to get it hydrated. I'm going to get my kidneys filtering. I'm going to get my skin sweating. I'm going to get everything opened up. I'm going to fix my elimination so it can then go back and fix these other digestive issues, because it is ironic that we have to address proper elimination to go back and fix proper digestion, proper absorption, proper utilization, because the reason they're down is poor elimination. So now we have to go to fix the elimination to get the better digestion, absorption, and utilization. So we're back to fixing proper elimination. Thank God you have the two sides of chemistry. You got the hydrating and the rebuilding, and then you got the corrosiveness. I know what I need to do to heal myself, but every time I try and go on a detox, I always fall off. Well, spend more time alone a little bit, honey, and get into yourself and go, you know what, I'm not so bad. I come from where everybody else does, and no one is above or below anybody else. You might be playing the role, and your movie, your journey might be that of an impoverished one or that of a wealthy one. But in reality, your awareness all comes from the same place. Your awareness is tuned somewhat through the mind and emotions and karma. It's expanded, tuned, and developed, so to speak. So you got to get a little more into yourself and love yourself a little more. No, you know what? This body is what I have to have while I'm traveling in the movie land, in movie world, in Jurassic Park creation. And, I just got to take care of my body and myself. At the same time, learn how to stop thinking. Learn how to put all of those thoughts, all of those emotions outside of you. Stop thinking for a while, sweetheart. Learn how just to be. You know what? I'm just going to hang around and take care of myself. I'm going to buy myself flowers. I'm going to go to the ocean, or I'm going to go to the woods. I'm going to have fun. I'm going to take care of myself. When you always pull someone into your arena to have fun with, you're losing the fun with yourself. You have the most fun with others when you're having fun with yourself. So it is important that you have fun with yourselves, because each and every one of you are uniquely beautiful, uniquely yourself, and part of the scheme of everything. but you come from the same source. Every one of you, every part of you comes from the same thing. So if you judge others, you're judging yourself. If you get mad at others, maybe you're getting mad at yourself. I know what I need to do. Okay, could emotional conflict with myself? Could be an underlying cause of my issues, but remember that emotions is spurred on by weak adrenals. So that's why clean and strengthen has always been my philosophy. Clean and strengthen, clean and strengthen. Become a warrior woman. Spend time out of thought and desire to where you can finally see what's really going on in life. Any tips to help get into a positive mindset to heal? Much love. This is Lily. I love the name, Lily. Absolutely. Hi there, I have Raynaud's for almost 20 years. I am currently detoxing with one of your specialists and wondering if you have ever 100% rid someone of this dis-ease. Smart thinking. Absolutely. What strategies have you found to be most effective? Getting rid of acidosis, getting into the endocrine glands, particularly the adrenals, enhancing that, but you also want to make sure that you're into the parathyroid and that sort of thing, because now you're going to be rebuilding. You want to get rid of any scarring and neurological breakdown of the myelin sheaths and all this, but you got to go to the adrenals, you got to go to the neurotransmitters, you got to get the acids out of these tissues. The same thing everywhere, and also highly recommend that you get the stomach and GI tract cleaned up as well, because remember you have the seat of the autonomic in that way. So another thing you can look at is the back. Make sure the spine is straight, you don't have compression, you don't have arthritis, things like that. Get that out of there. That can seek out all peripheral neurological problems and things like that as well. Get the kidneys filtering. Upper circumbrain nerve, upper lower circumbrain and nerve. Absolutely. I go after the brain and nerve heavily with this, but you need to get the adrenals up, neurotransmitters up. Get the acidosis out of these tissues. Again, make sure the spine, there's no compression, things like that. If the autonomic nerve sheaths are chronic, get after those adrenals. Rebuild, clean and rebuild. Because this is a rebuilding program. Your body is designed to regenerate itself. Hello? And you want to always know that. And man forgot that because man was listening to medical thinking. Medicals didn't create nature or anything like that. People say, you're about nature. That's God. We only use that word because what else are you going to use for it right now? God created life, the form, all the way the form works, the foods for the form, the whole 9 yards. Man needs to wake up. Quit getting into academics so much. We've overran academics so much now we're acting stupid. You've hit a wall in academics. You got to back up a little bit and have some fun with this because everybody's too serious and too academically inclined. It's like, back up, simplify, have fun, enjoy. Don't take things so seriously. Live on the words of truth always, no matter where they take you. Get rid of your opinions and your ideas of things. Have no opinions. Just be. When you're at that level, you will then be used by the divine for everything you can imagine. You will then see truth and be used by the divine to help others to see truth. Now you're on your journey away from creation, away from the drama and the soap operas of life. And you're helping others to wake up as well. So, very important to go after all those things I said like that. Hello, we are both diabetics and we want to do your lymphatic cleanse to get rid of mucus, mucoli. But we have a problem with eating fruit all day and protein at night. It is okay to eat protein in the morning and fruits the rest of the day, or will this destroy the process? What? I thought the name was Delirium. Have you ever heard of the group Delirium? They're pretty wild music. I did like that. Delirium, and then one of my favorites is, I haven't heard him in a while, but Enigma. Oh, I love Enigma. Their old music was so good. A crazy kind of guy. I'm an old rock and roller, but man, I love Enigma. They're pretty good. I don't know why you're eating protein. First of all, your body can't use it. Second of all, you're hitting your body with high amino acids. You want to detox the process. There are plenty of amino acids for repair and carriers in your fruits. Easy. And in your berries and your salad. So I don't know why you're having get rid of the protein. If you want to do anything, have a big salad at night. But you always want the fruit in the morning. You always want to break that fast in the morning. Well, then have a big salad afterwards. Another thing you might think about, if you're having a hard time with these things, deworm yourself. Go on like Parasite G, about 3 or 4 capsules 4 times a day with Parasite M. And, really go after deworming yourself. And you might be surprised. You get too much craving for protein and stuff. My sister always had a lot of pain in her gallbladder area and, stomach area. So they removed her gallbladder. It's like, you remove before you know. So they told her, well, that wasn't it. It's like, you removed it and that wasn't it. And so she kept having the problems. So she was down here. She was in Indiana, and she was down here, and we went out to eat one time, and she ordered a steak. And she told the waiter, she said, just throw it on the grill and just flip it on one side and then the other and let it walk out to me. That makes me want to throw up just thinking of that. But then I looked at her and go, you know what? I know what your problem is. She got 3 large tapeworms, and I mean, these had to be 20-footers. Been in her all her life, or more. One's the longest one at the Smithsonian or something, 32 feet or something. And your small bowel is only 22 feet. Your colon's only around 5. So you might try some of those things, Now, the diabetes. Well, let's talk at it as it's not a disease, because the fallacy of diseases is just ridiculous. So you got 2 types of blood sugar problems. You either have a metabolitic problem, which is the adrenal glands, that's what they call type 2, or you have type 1, you're not producing enough insulin to carry that, supposedly, and they have different ways of stating that. Your simple inferior sugar of glucose across the cell wall. It amazes me that we need a carrier for our glucose anyway. Funny that we don't need it for insulin, even though they make claims to that. Their claim is that the body takes a fructose, a simpler, better sugar, converts it back to another simple sugar that's inferior. For what reason? Because you still get ADP, AMP, and ADP. So for what reason are we talking about? See, there's so much idiocy involved here, so much propaganda bull crap that you don't know what to believe anymore. That's why we want a good naturopathic college that's based completely on truth. But I would be going after my adrenal glands, because even in type 1, I'm telling you, there's always adrenal gland involvement. To get to type 1, you have to have lymphatic problems. To get to type 1, you have to have neurological problems, either one. And that takes you into kidneys and adrenals, which can give you type 2. So type 1 always has the type 2 involvement, adrenal glands, always. So you're going to always work on both of those tissues. But I tell you, and remember that a lot of these problems are neurological weaknesses as opposed to cellular tissue weaknesses. So you always want to remember to work on that side of your body as well, the neurological side, which is the adrenal glands, the central, the autonomic. That's where I'd be going. What does the MH after Dr. Morse's name mean? Master Herbalist. Dear Doctor, thank you for everything. You are a real thanks, man. I love you, man. Try to be. I mean, there's just so much propaganda and lies and crap and perverted ways of looking at things. We need to get the humans out of that and up into a more refined spiritual view, to where there's love for each other, there's understanding of the bodies and how to keep them well and healthy, that sort of thing, Change the paradigm. Thank God who created. Oh, thank you for the. Oh, thanks. I love that. Thank you. Oh, this is Florence. You're not Florence and the Machine, are you? They were at Austin City Limits. Florence and the Machine. Gosh, she's good. I really like her. She had a background singer. She was really good. She had 4. She had 4 women background singers. 2. One played the trumpet and one played the trombone. That was pretty cool. She's good. You got to be out there to understand her music, but that was good. Thanks, Florence. Thank you very much, honey. Please forgive my poor English. Mine ain't so good either. I'm a French woman. Morse is French, you know. A French woman, and I will try to explain simply the situation I am in. I know eating fully raw feels like being alive, finally, but 2 years ago I got a parasite infection, Giardia or whatever, during a trip to Africa. Ooh. I got a parasite. Okay. Since then, my gut can't absorb properly, which leads to many symptoms hard to live with. I have to say, this little Giardia is a great teacher to understand the body, isn't it? Whatever I try, even if I see improvement, I can't get rid of it. Please tell me what I need to do. Could it be helpful to take Golden Seal? But you could. I would take Parasite G, about 4 capsules 4 times a day, and take Parasite liquid at the same time. Dig in, detoxifying it a little better. Use the GI broom and things like this. Sounds like interstitially you're pretty backed up there. The only reason you're probably having a hiccup on it, but Giardia is not that difficult to get rid of. So I don't know why you're having such a hard time with it. But use the parasitic formulas and keep detoxing deeper and deeper into that. And is it safe while breastfeeding? My baby is 5 months old. Yeah, I don't know if you want to hit heavy parasitic herbs with the baby. Only because, when you get up into the big boys, like the wormwoods and stuff. I mean, they use wormwood for cancers and stuff, and it's supposed to be toxic, but I've taken a lot of wormwood under Hannah Kroger. But it probably wouldn't hurt with some breastfeeding there. Probably deworm the baby as well. But do about 3 or 4 Parasite G's there. But again, you got to detoxify, and now you're breastfeeding, and so your baby's going to detoxify a little bit with you. Now, thank you, sweetheart, for all your kind words, Florence. Love you, honey. But yeah, I'll work with that. But Giardia, I've never had that much problem with Giardia. So, but it sounds like you might have a chronic gut. So, again, get the kidneys filtering. I mean, you're going to want to do this anyway with the baby, and you want to make sure your baby's filtering. I mean, these are very important things, or your baby's going to get the same thing as you. And you want to make sure your milk is alkaline, honey. Check your milk chemistry. Make sure your milk is alkaline, or you're going to fill your baby full of you-know-what. Hello, Dr. Morse. Lots of love and respect from Russia. Yes, yes, yes. I hear Trump is going to be meeting with your man over there. What's your opinion on breathing techniques? Well, to tell you the truth, I think that one has to relearn breathing. I think because of the nature of acidosis, man has shallow breathed for far too long. He has lost his ability to properly breathe. Because in proper breathing, your first breath is not going to be a thoracic breath. Your first breath is not going to be like this. That's not your first breath. Your first breath has to be down here, pulling your air into the lower lobes. So you want to abdominally breathe. So your first action should bring your abdominal muscles up. Like this. I don't know if you can see that, but your first action needs to be here, where breathe here first, and then thoracically breathe. So here first, and then here to complete. Now you've got full lobes full of oxygen. And that's how you clean them out that way as well. You deep breathe enough like that, fill these lower chambers. Pretty soon you'll start getting mucus out, because you're bringing in oxygen, which will help to break up mucus and stuff like that. Kind of like a solvent sort of thing. But that's how I would do. There are the 15 rites. I believe it's the 15 rites of the monks for nirvana, things like that. There's all those things, of course. It's been a lot of years since I've been involved in that, though. Have you ever heard of Buchinko's method? Or I'm sure I can't pronounce that correctly. The main idea of it is that a reduction of breath leads... The holding of breath for like 4 or 5 minutes, that sort of thing. Yeah, someone else was telling me about that. I think anything you can do to expand that, but let me look at this. The main idea is that a reduction of breath leads to a better oxygen saturation in blood because of the Virgo-Bohr effect. Less CO2, less oxygen binds in hemoglobin. You know, I've got one of these little O2 saturation things, and I've watched this. Your O2 saturation actually goes up when you breathe properly. To be honest with you, I would think that less O2, the more CO2. That's what I would think. I would think it'd be the very opposite of what this guy's claiming. But you know, that's actually, I get that. But how would less oxygen binding with hemoglobin cause a better O2 saturation? The most interesting point is that when a patient increases carbon dioxide in his blood, he starts to experiencing detox symptoms in reverse, but then goes to normal state. Dangerous thought, because you know I mean, you can convert carbon dioxide to water, but it's still an acid initially, a toxic one at that. And building up carbon dioxide in the blood would not be smart, because then you would have, of course, the claim is then you would have your bicarbonate bump from that. You know, that's because in your blood work you notice they look at CO2, but really they mean bicarbonate, only because of the bump you get from that. I suppose that's their thinking, but I'm not into that sort of thinking. I would want to deep breathe and bring oxygen into my chambers, and therefore help to hydrate and bring about a proper detoxification. I don't see the philosophy here, but that's just me, you know. Matter of fact, if you build up O2 in your blood, you want to be careful about the symptoms you do experience, because they're not all favorable. You have to be careful, because again, when you start bringing in too much of an acid in the blood, no matter what it is, you have the fear of initiating the calcium buffering system. Well, you know, that then brings you thoughts of aneurysms and petechia and bruising easy and varicose veins, spider veins, things like that. This method is primarily designed to cure such conditions as asthma, hypertension. You know, to write off, when someone tells you that a breathing method is going to cure these conditions, close the book and walk away, because that is as stupid as you can get. There's real reasons behind these other things, and it isn't building up O2 and building up oxygen. No. Asthma? Are you kidding? That's a neurological weakness. You're not going to build up O2 and rebuild your myelin sheath by increasing adrenal performance and neurotransmitters through O2 holding. No. Hypertension, that's your kidneys. You know, it's funny. All these different things people come up with, and I've seen it in Russia, but I see it everywhere else, so, you know, it's everywhere. You know, stool implantation, urine, I mean, the vitamin C intervene, all these things is because people don't understand the real cause of man's problems. They're suffering, and they're grabbing at straws and coming up with ridiculous theories, like your Budwig theory of your Russian Budwig theory of your oil and cottage cheese. You know what I've seen with that? Tumor growth. But I would. We have to be very careful in our understanding of how the body works and what we do to find remedy. We're reaching for straws when the answer is right in front of us. Your truth is right here in the lymphatic system and in the nature of the chemistry you've been playing with. It's that simple. And to deny that and to just grab all these things, you know, and these people claim to be somewhat chemists or biochemists, like the Budwig. It's like, but it don't make any sense, man. You got to have more than biochemistry in your thing, and particularly more than traditional biochemistry. You know, I've always said, you know, when you start studying academics, you're studying what they want you to learn. But you know, there's real problems in asthma, hypertension, anxiety, your adrenals, and wrong pathway to fix these, in my opinion. Tends to cure even cancer and diabetes. You see, when you bring up these things, that's not my field. I don't cure diseases. They're particularly incurable, and if you're claiming holding O2, CO2 in this to cure these things, these incurables, You know what I'm saying? Back away from that level of thinking, because one's going to get you into trouble too, because the medical community does not want you using their nomenclature. They do not want you claiming you can cure any disease, because they're incurable. They don't exist. That's why. Diabetes is only a name for blood sugar problems, but in the name of it as a disease, it's incurable. It's an autoimmune problem. But in sugar metabolism problems, very curable. See what I'm saying? The difference is the name of a disease versus the actual pathology, or the actual cytology of the problem. You know? So what they've fancily done, since they don't understand the cytology of the problem, cell morphology and all that, and the lymphatic system and how all that works, they don't know any of it. So everything's diseases, and you got to treat them, and then they've convinced everybody else you got to fight it since they're incurable. We're going to grab at everything else to try to cure them. So you got everybody out there, even the natural people, grabbing at shit to try to cure them. And there's no cure to them. I'm trying to tell you. They can rip out organs and glands and say you don't have it anymore. But what you still have is the lymphatic system that broke down the cells. All they did was remove the effect of it. How stupid. I mean, it's just real serious. You know, you guys really want to get with that understanding of this, because, you know, there's so many people make claims like this, treating diseases. We don't make any claims like that, because you'll never cure any disease. They're incurables. If you're having acidosis, if you're having tumors, you're having cells that have been called cancer cells or atrophied cells, that's easy to deal with. Well, easy depends on the level you're involved with. And the problem is, if you listen to these jokers for years and you've been dealing in their word cancer, and they've been hitting you with chemos and suppressive techniques, yeah, you're pretty much letting them walk you to Hellville and Deathville. Mm-hmm. And the answers are very simple, and they still don't understand them, because these are complicated diseases created by the intellectual brain that doesn't understand the simplicity of how the body works. And you guys do. So be real careful, my dear one, that you not get caught up in this and get lost in it, because these things take you off your path. And they're designed to. The mind would love to take you off your path. Remember this, in spirituality, you are always tested, my dear ones. And thoughts is how the negative forces test you. So, you know, talk to the hand, the face isn't listening syndrome. You want to spend time out of the world of thought. Because as long as you're in the world of thought, you will always bump up against preconditioned ideas and propaganda and ridiculous theories that hold no water and things, and you will not understand truth because you're lost in academic thought. You can't see truth because it doesn't exist in academics. Some maybe, 2 and 2. See where I'm going here? Sleep? Thank you. All right.
Yes. She'll be right.
Yeah. I'll say.
G'day, mate.
Yeah. All right. Oh, man. Excuse me.
No.
There. All right. I want to know is healing is possible only if we eat raw food? Is it not possible if we eat healthy cooked food? Good question. Along with, excuse me. Oh man, I went down the wrong way. All right. Is it possible to get healing only if we eat raw food? Is it not possible if we eat healthy cooked food along with fruits and vegetables without animal products and your tinctures? Now, I have 8 years boy with autism. We can't live on raw food. Thanks a lot for your kind heart and advices. Oh wow, India. Well, that'd be the second best. Is to have your lightly steamed vegetables not your vegetable kormas. Oh, now I got thinking of Indian food. Oh, our Indian restaurant closed up shop. We got another one in town. Excuse me, guys. But they're too spicy for me. Oh, now I'm thinking of vegetable korma. Anyway, lightly steamed, you can get away with that with the fruits and things like that. Yeah, you can still do well. I would definitely get into the herbs though. You want the upper circumbrain nerve. You want to get... The problem is, if you have autism that's directly related to neurotoxicity, that would be vaccinations and thimerosols, any type of there's over 2,000 neurotoxins in our environment. A lot of ladies, you poor things, they got a lot of your perfumes are neurotoxins. You know, they don't use the pure stuff on you ladies. It's like, thank you. Even Shania Twain, I love her to death, good old friend. She's got what, 2 lines? And it's like, are they 100% natural? You want 100% natural stuff. If you can't eat them and all that stuff, then why do you put them on your skin? Better to go to essential oils and stuff like that. But when you're getting into neurotoxins, I just have to tell you, when you're dealing in any neurological problem, nothing below fruits and berries will help. That's the problem. Is when you get highly involved here and you've got to rebuild the myelin sheaths or you have neurotoxicity suppressant, you've got to get neurotoxins out. Well, they're probably the hardest to get out in the body's neurotoxins. They go right to the neurons, they go right to the myelin sheath, so, you know, it's a tough one. There's no question about it. But, you know, whenever I see neurotoxicity or neurological, I don't even do the vegetables because I have very little success even with the raw vegetables. You're talking about the nervous system here. So you might have to try to find a way just for 6 months to hit the fruit with this young man, your child. Maybe you don't have to do it, but if you can't by any way, shape, or form, then you want to get as much fruit as possible in that diet. Secondary, as much berries as possible in that diet. Third, as much melons as possible in that diet. And if there's any room, then go to the vegetables. A little lightly steamed vegetables. Then you would hit the kidneys, the lymphatic formulas. You'd really want to use the herbs to go in and try to affect, you know, some detox and get these neurotoxins out. Stay on the upper circumbrain and nerve in particular. That would be a must do. You know, because it's tough enough to rebuild the nervous system. And all my MS, Lou Gehrig's, all these neurological cases that they have stuck disease names on them. The nervous system is the highest energetic system, and remember, when you steam or cook vegetables, you're losing the electromagnetic energy. Well, they are already lower than fruits by far. So that's another problem that vegetables have. They don't have the electricity for the nervous system of humans. Humans are the most electrically alive vertebrates. Take a look. I mean, you don't see a monkey creating the Empire State Building. But you want to get your boy up there and detoxed because that's not a fun thing to have. And very, very curable. Talking about curing, talking about Indian food, I'm hungry. I want lunch. All right, I'm going to do one more. And this is Miranda Lambert. Having beaten left side breast cancer 2 years ago. Now, that scares me. Because you haven't beaten it. Okay, so let's see. With no chemo and radiation, it has returned in the lymph at the same side. Okay, now, so you didn't cure it. Now, left kidney, left adrenal gland, Well, you can't just work on one kidney, so here you got to do. You got to get yourself filtering, and this time, really get yourself filtering, Miranda. Use these 24, 36-hour dry fasts, and if you have to, go 2, 3, 4 days. I'm learning the benefits of that. Matter of fact, I've got to go find that. I'm making copies of this. Thank you for sending me this thing on dry fasting, because it is quite interesting about the stem cells and all that. I'm still researching to make sure that it's accurate. But interesting thought about that. When you dry fast, the body floods itself with stem cells, which is interesting. I'd have to look at that. But it's just enough to say, sweetheart, that you haven't got your kidneys filtering at the level that you need, and that's all it is. So go back, get your kidneys to filter, and hit it hard. Go after that lymphatic system. This side, this time, get her done. All right? And I mean, push it, push it, push it, push it. Do a 20, 30-day grape fast. Push it, push it, push it. Matter of fact, it's all gone. Push it, push it, push it. It's all gone. Push it, push it. Oh, it's really all gone. And my kidneys are filtering, and the cause of it is fixed. And I'll never have that problem again. Because when you see something coming back, you didn't fix it completely. So push it past, push it past, push it past, till you can't stand fruit diets anymore, and now you made it. My friend noticed these large black dots around the pupil in the color part of my eye. Notice these large black dots around the pupil in the color portion of the eye. Okay, so black dots. Now that's either drug deposits or they could be the sore spots. These are weakened areas from genetics. And when she pointed them out to me, I remember someone mentioning them over 2 years ago when I was first sick. Ooh, now you've got me curious. You don't send me any pictures, honey. I gotta see what that is. Are they an indicator of cancer or something I need to get out of my system that is contributing to the cancer and its return? Okay, so let's talk about that real quick. Remember what medical doctors call cancer. Now, a lot of people have a lot of ideas about it, and, you know, the medical doctors have said so much crap and lies about it that no one knows the truth about it. So remember, when someone utters the word cancer to you, whether it's an oncologist or some type of medical professional, they're talking about a damaged cell. Matter of fact, where's our latest man? I hope they even gave it to me. Because I love science news. I love science news. And we've got the latest science news there. You never give me my science news. But it's got a picture of a cancer cell on the front cover of the science news. And you get to see all the mucus. And you even get to see the fungus growing on it. And because when you start to damage a cell, wait a minute. I'm a cell in your breast. Okay? I'm pretty happy, I guess. Everything's good. How you gonna hurt me? How are you gonna take me as a healthy cell in your breast and damage me to the point that I can't function anymore, and now I'm going to be removed and taken to a lymph node? That's the process. Now wait a minute. We got a problem. First of all, for me to be damaged, the site of chemistry that damages you, chemistry has to damage me, right? I'm a cell in your breast. Chemistry has to damage me. That's the only thing we have is chemistry. We swim, everything's chemistry. So do we agree now that chemistry has to damage me as a cell in your breast? Right? All right? So, well, wait a minute. What side of chemistry? There's only two sides, so what side of chemistry damages me? It's not going to be the base side. That's my electrolytes. Oh, that makes me feel good. Acids. Ow, 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 ow. That burns. Ow, ow, ow. Acids. All right. Where do they come from? Well, I'm a cell, and inside of me, I have organs and glands, basically. I'm another little person inside of me. I have things going on in the micro nano levels that even medical doctors have no friggin' clue. Humans don't have a clue. Most species actually in creation don't have a clue. But I just tell you, there's things going on at supra nano levels. You can't believe it. So, I'm a cell. So if you're going to damage me, it has to be the acid side of chemistry. Well, wait a minute, I've got chemistry coming in, so I'm having chemistry come through my cell wall all the time, metabolizing, using the energy from it, and then I've got to eliminate, right? A cell just doesn't take in goodies, it also eliminates waste, right? Exactly. I'm not just going to take in, I'm going to be eliminating. So is that why on the outside of me I have two separate fluids? One for the nutritional side and one for my sewage? Could that be true? Absolutely. So is blood damaging me as a cell in your breast? Is blood going to damage me? Only when it's restricted to me. If I don't get blood, I'm going to die, right? Right. All right? Now, that's the only time blood's going to damage me because I've got the bicarbonate system, I've got the calcium buffering system. So if I eat a high protein diet, by the time that blood gets to me, those acids shouldn't be in the blood too much. They should be pretty much rectified with the calcium, stealing of calcium out of my walls, stuff like that. So here I am, a cell. What system is going to be the system that's going to damage me? And they admit it. Lymphoma, the lymph system. All right, so that's 80% of the fluid outside of me. Oh, wow. Holy crap. I'm damaged. Oh. So I can no longer, as a damaged cell, be taken to the lymph nodes because that pathway is agglomerated. That pathway, since the kidneys have been damaged by acid ash foods, high protein diets, guys, damages kidneys, factual. Take a look at all the bodybuilders and people. So the kidneys are damaged by our lifestyles and our diets, and so now I no longer can filter, so this whole 80% fluid around me is no longer. We're in stagnation. We're in agglomulation, and the word we use for that is acidosis. So I no longer can get rid of my waste, and so for a while I'm protected. I've got HDL, phospholipids in my wall. I'm pretty protected a little bit. Nutrition keeps coming in. I got to keep pooping. I got to keep eliminating waste, and everything around me keeps swelling. Oh man, things get hard around me because all this fluid outside of me is getting harder because it's acidic, agglomerated. But when no longer I can eliminate outside, I start, like a baby not changing the diaper, I start burning myself inside. My organs start getting broken down. My DNA gets mutated. Chromosomes are mutated. Because acids are corrosive and breaking me apart, I can no longer get rid of them. So now how do you fix me? Vitamin C, send another acid to me? Chemotherapy, send me another acid to me? Does that make sense? That's about as stupid as you. That's criminal. So here I am. I'm a cell. We know acids are damaging me, and we know what system's damaging me. So what am I going to work on? Does it not make sense that I'm going to work on my lymphatic system? Yes, but this world doesn't know about it. We're the ones that introduced the lymphatic system almost in its entirety. So that's what you have to learn, is the lymphatic system and how it works, honey. And the adrenal gland and kidney connection to that. And that's what you didn't fix completely. And so now you're getting agglomerated again. You got to go back and fix it. Because I'm a cell. I'm not quite damaged to the cancer level yet, to what they call. Remember, cancer is a nasty word for simply a damaged cell. Of course, it's at a point where you can't rebuild it anymore. Those cells that you can rebuild are called what? Atypical. Atypical simply means I'm moving, I'm getting burnt, I'm getting damaged, and I'm moving slowly toward what they call, which is a slick name for me as a damaged cell, a cancer cell. Now, I can't influence other cells and tell them to become cancerous cells because I'm on my way out. Plus, their individual cells, the same problem. They're sitting in their spaces with fluid all around them. So this idea that I can come out as a damaged cell and travel somewhere via the blood, this is why I brought Pat here, to the A&P professor, to talk to you about that. Impossible. And then influence another group of tissues involved and already locked in space. I mean, the idiocy is ranked high, and you don't want to fall into that. And people are falling into it and getting their lives terminated. A great bump for the World Bank in population control. Every time they see cancer deaths, they're going, yeah, we're getting that population control in. That's disgusting. It makes me want to throw up. And it's time we get our power back as people, as humans. But you got to understand what this stupidity of cancer and that whole 9 yards is, and the killing machine that it has become. But if you don't understand this and you accept their theory as true, even though massive loss of life is taking place under their theory, massive loss of life, you've got to understand the truth here so you can empower yourself to fix this properly. And if you don't fix your lymphatic system and you don't understand it, then you're going to be a leaf in the wind, and they're going to find you and burn you and destroy you. They're narcissistic elitists. They think they know everything and they know nothing. Interesting about that, how much they think they know and how little they know. Just vomitous to me. All right. So, I just purchased weeks 1 through 8 of your herb course, and will buy weeks 9 through 14 when the time comes. I hope you can provide me with some insight to the connection, if there is any, plus some guidance on the steps I should take. This would be much appreciated indeed. Kind of Scott Miranda. Excuse me. Drop me 20-day grape diet. If you want to know what I think right now, drop me 20-day grape diet. You could add maybe a little lemon juice in there if you want to. All right? When you break that, then go to a fruit, berry, and melon diet. I would get on, make sure your protocol includes, since you've already been doing this pretty good, you can handle 2 lymphatic formulas, do 2 kidney formulas, 2 lymphatic formulas, 1 tincture, 1 capsule, same with the kidney formulas. You want to dig into those adrenal glands, make sure your blood pressure is moving up to 120/60 or somewhere real close to that. Look at your eyes, make sure everything's coming clean in the breast area, the lymphatic system's coming clean in the body, that sort of thing. Make sure malabsorption, everything is rebuilding and your eyes are changing, that sort of thing. Make sure there's no humps, lumps, fibrocystic, nothing, no ovarian cysts, uterine fibroids, endometriosis, all that stuff's gone. All this stuff is lymphatic stuff. And you'll win the day, my dear. You're going to win the day. You'll be fine. But get focused on the system that's causing the problems. And that's what each and every one of you have to learn, especially you ladies. Your ladies are being chewed up by these men. And you know what? Time to get your power back, ladies. I'm just telling you, this is ridiculous what's going on in our world here, and it doesn't have to be. We need to stand for truth. And you ladies are the alkaline principle. You're the principle of truth. And man has to learn that. So I love you guys. I'm going to go get some lunch. And we got some done. Remember this when you think about nutrition. And when you think about high protein diets, ask yourself, then how come it's the least constituent in mother's milk? When you understand that acids are the most powerful corrosive side, you understand why you have to meter how much you consume. And you got to remember that foods are either one of 2 types, either acid ash forming foods or alkaline ash forming foods. Acid ash forming foods are a huge no-no. Now, of course, vegetable korma is going to be alkaline ash foods, of course. Love you guys. Thank you so much. See ya. I am getting caught up, so I have got time to plow through this. And I appreciate you guys hanging in with us. And We've been so busy here. I've been so busy not being able to get to these. But we've got a new lymphatic iridology chart. I mean, it's almost done. We're the first ones to have it. Lymphatic iridology. My book is almost out on lymphatic iridology. And this ought to help a lot of you iridologists understand a much higher level of reading the eyes, understanding a lot more about what the eyes mean, and also that dispelling a lot of the myths of iridology. There are some things in iridology that have been carried over that, in my opinion, are just not true. And that we can then connect and get a little deeper in the understanding of iridology, the understanding of the lymphatic system through iridology. I mean, that's where we get to see all the things. And this also answers the questions that we've always had in iridology. Bringing forth the lymphatic understanding just makes the jigsaw puzzle complete. I love you guys. See you on the next vid. Yeah, see? Yeah.